Namaste, hello everyone. Myself, Dr. Jayakumar P, Interventional Cardiologist at ClearMedi Multispecialty Hospital, Mysore. For next 1 minute, briefly I will be talking about the link between sleep apnea, particularly obstructive sleep apnea and heart diseases. There is a strong correlation between obstructive sleep apnea and heart diseases. Sleep apnea is characterized by more pauses during respiration, especially while the patient is sleeping. So during these small pauses, there is decrease in the oxygen level in the blood, leading to hypoxia. These in turn lead to multiple complications. For example, it will going to increase the risk of inflammation throughout the body. It will also increase the risk of increase sympathetic activity, which in turn lead to increasing the heart rate and blood pressure. It also increases the risk of endothelial dysfunction, that is the internal lining of the blood vessels, thereby damaging the endothelium, which can lead to increased risk of plaque buildup and narrowing of the vessels. So sleep apnea is also associated with increased risk of hypertension. It can worsen the heart failure, existing heart failure patient heart. It can increase the risk of new heart failure chances. It also increase the risk of stroke. It can increase the risk of arrhythmias. It also increases the risk of sudden cardiac death in this patient. So there is a strong correlation between obstructive sleep apnea and sudden cardiac death. Some of the risk factors for sleep apnea are: one is the common is the obesity, alcohol, male gender are more prone for sleep apnea, and smoking. So these are some of the risk factors for some of the standard risk factors for sleep apnea include overweight, obesity, alcohol, sedentary lifestyle, and patient who are already known hypertensive, especially metabolic syndrome, pulmonary hypertension, chronic heart failure, acute heart failure should be screened for sleep apnea. The standard treatment include continuous positive airway pressure, or CPAP what we call. It involves putting a mask on the face, and with the pressure we are going to push the air inside so that the oxygen level can be increased. Also non-medical treatment includes weight reduction, regular breathing exercises, and meditation. I think this goes a long way in helping this patient by identifying, screening this patient, and also treating this patient is going to help in reduction in the mortality and morbidity of cardiovascular system. Thank you.